You, Allie. And good afternoon, everyone. And thank you so much for being here and taking time out of your day to join us. As Allie mentioned, my name is Ann McCafferty, and I am the program director for the Indiana Healthy Families Alliance. And with me today is Bryce Wray-Nelson, our program coordinator. The Indiana Healthy Families Alliance provides free health coverage navigation across the state. We help families apply for coverage, complete renewals, manage benefits, and retain coverage through life changes and resolve issues that could put their coverage at risk. Today's conversation is meant to be practical, not policy heavy, not complicated, just real world information that you can actually use when you're helping individuals and families. Over the past year, I think one of the biggest things we've seen across Indiana in our program is confusion about Medicaid renewals. Who has to renew, when they renew, what notices mean, and what happens if something gets missed. Because of that, we're going to do this a little differently today. We're going to use more of an interview style format. We've taken the most common questions and feedback we hear from partners, providers, and families, and built those directly into the presentation. And then at the end, as Allie mentioned, we'll leave time for your questions. By the end of this session, our goal is that you feel more confident explaining why renewals matter, who actually has to renew, and what the renewal process really looks like step by step. We'll also talk through the common mistakes we've seen that lead to coverage loss, how we can work together to improve renewal outcomes, and most importantly, where people can turn to get help renewing their Medicaid coverage. So with that, Bryce, I'm going to ask you your first question,
All right.
which is a very simple one. What is a renewal and how often do they occur?
All right. So a Medicaid renewal, which is also known as a redetermination, it's basically a review that's conducted by the Family and Social Services Administration, FSSA, basically ensuring that the member is meeting ongoing eligibility requirements. And so usually these redeterminations occur annually, but if any major life changes happen, they can occur more frequently.
All right, so you mentioned that the renewals usually occur annually, right? But
Mhm.
I've heard that recent legislative changes may affect how often renewals occur. Can you explain what those legislative changes look like and how and if they will affect those renewal timelines?
Yes, absolutely. So let's take a look at Public Law 126 or State Bill 2. And so it's basically, quarterly redetermination checks, which was effective May 1st of 2025. And so basically what this establishes is that FSSA is going to be conducting quarterly checks electronically. And so then if electronic discrepancies are found within an account, then Medicaid members will potentially be contacted and will need to comply by confirming that information, providing updated documentation, and explaining what those discrepancies are. So quarterly checks are basically meant to confirm that a member is continuing to meet eligibility requirements throughout the year. But I think it's really important that we remember that just because we have quarterly checks doesn't mean that the annual renewal redetermination is replaced. It's just something in addition to the redetermination.
Okay, got it. So in there, you mentioned that if an electronic discrepancy is found, members may be contacted and must comply. What is a discrepancy? What might that look like?
hmm So, for an example, let's say that FSSA conducts a quarterly check, right? And their internal electronic employment history shows that the member works at Olive Garden. And who doesn't love Olive Garden? The member's not worked at Olive Garden for months in all reality. So then FSSA will give the member an allotted amount of time, which they can provide a written statement from Olive Garden to verify their end of employment. If the member fails to provide that written statement by the due date, then their coverage could end because that supporting information to verify end of employment wasn't provided by the member.
Okay, got it. So quarterly redetermination checks don't replace annual renewal requirements. They're just
Mhm.
quarterly checks that the FSSA will conduct. And
Mhm.
if they need anything additional to verify what they've found electronically through their internal systems, they'll reach out to the member. Is that right? Okay.
That is correct.
Okay. So any other legislative changes that affect renewal timelines?
Yes, so there's a very important change coming in 2027. Effective January 1st, HIP members must undergo a formal redetermination to renew coverage every 6 months. So this will be biannually instead of the normal annual redetermination.
Okay. And I know we've used like Medicaid members kind of broadly.
Mhm.
Um, can you can you give me a better idea, maybe in terms of like programs like HIP or Hoosier Health Wise? Can you give me a better understanding of when those members have to renew, keeping those legislative changes in mind?
Absolutely. So, by federal law, all Medicaid members are required to renew their coverage every 12 months. The chart on this slide actually shows a breakdown of renewal requirements by program. So that kind of lays it all out there per program. What are the requirements? And it's put together very nicely.
Oh. So I'm looking at the chart.
Yeah.
And I notice I don't see anything about hip maternity
Mhm.
or Hoosier Health Wise for pregnant women. Do renewals look different for pregnant women?
Yes, so those requirements do look different for pregnant women. So typically, they won't be required to complete a renewal redetermination during a 12-month postpartum period. Now, after that coverage period ends, they're going to be receiving a renewal packet that will begin following the standard redetermination cycle. And so, when considering that transition, the coverage category is going to change. So instead of hip maternity, then members will shift over to just HIP. A renewal packet will be issued around the time of the baby's first birthday, and then income eligibility will be reviewed under non-pregnancy standards.
Okay. So we now know that every Medicaid member is required to renew their Medicaid coverage at a minimum annually, and then keeping those changes in mind for 2027 for HIP members. And that pregnant women can expect to do a redetermination around their baby's first birthday.
Mhm.
How will members know when it is time to renew their coverage?
Yeah, absolutely. That's a great question. So members will receive an FSSA renewal packet in the mail. If they've opted in to, text messages, they'll get a text message, emails, right? And then they can also find a notice in the FSSA online portal, and that portal is linked in this slide.
Okay. So once a member receives a notice in the mail, or they've opted into that text option where they get a text, or they've seen a notice in their online FSSA portal,
Mhm.
then what do they do next?
Yeah. So next steps. First, you want to be sure to open and review that renewal notice immediately. Don't set it on the counter. Don't put it at the bottom of your junk pile. Just go ahead and make sure you open that up. Go ahead and gather the required documents that are outlined in that renewal packet. You complete and sign the form, and then you submit that form and all supporting documents before the deadline.
Okay, and you said they submit their form. How do they
Mhm.
submit their form?
Well, thankfully, FSSA has put together quite a few options in how they can submit. So you can submit that online through the benefits portal. You can fax it over at the number on the slide. You can even do snail mail to their office in Marion, and then you can also do in person at the Division of Family Resources, or you can also go through a wonderful IHFA Indiana Navigator.
Well, I'm glad you said that about the IHFA Navigator. Um, I'm assuming because you do have IHFA navigators that you've assisted a lot of families with their renewals.
Mhm.
Can you tell me some of the common reasons that that this program sees of why a renewal might be denied?
Yeah, absolutely. So these are just some common reasons, right? Most common is because the deadline was missed. If a form was unsigned or incomplete, if they are missing any supporting documentation that's required by FSSA. Unfortunately, if the renewal application is sent to the wrong address, that does happen. And then if members assume that they will be auto renewed.
And what does that mean? Auto renewed.
So an auto renewal happens when FSSA renews Medicaid coverage without requiring the member to complete and return the renewal form. So instead of sending the renewal application to the member, the FSSA uses electronic data sources to confirm their eligibility. So essentially, the member doesn't have to take any action. So people may assume that they'll be auto renewed because, well, first, it happened before, especially during COVID, when renewals were paused and everyone auto renewed. Number two, they think that because nothing's changed, that they don't have to do anything. They don't have to make updates or anything like that. Or number three, they didn't receive anything in the mail. So they think everything's fine. And that last one is probably the most common reason that our IHFA team sees for renewal denials. So basically, people move, they forget to change their address with the FSSA, right? Life happens, we get it. Then they assume because they didn't receive a notice in the mail that they don't have to do anything, not realizing that they didn't update their email, or excuse me, their mailing address. So it's very important that people check in with FSSA either by calling or checking their online portal to make sure that their contact information is up to date.
So you said it, life happens. Like
Mhm.
we know, life happens. What if a member just they forget to send in their renewal or they forget to sign something or fill in a section on it um, by the deadline? What happens to their coverage when this happens?
Yeah, so unfortunately, their coverage will terminate, right? However, we're very fortunate because Indiana does have a 90-day reconsideration period or a grace period of sorts that kicks in after coverage ends so they can complete their renewal. And after 90 days, then the member would have to reapply for benefits.
Okay. So in other words, that reconsideration period or grace period,
Mhm.
it's like a safety net.
Yeah.
Okay. Um, are there reasons why you wouldn't want to complete, why not just wait and go, oh, I got a safety net? Is there a reason you wouldn't want to complete it during the 90-day grace period?
Yes. So it's definitely best practice to avoid a renewal processing within that 90-day reconsideration. Because, think about this. Your coverage has already been terminated during that time. Medical claims likely will be denied. Pharmacies aren't going to be able to process prescriptions unless they have active coverage. And then vital healthcare appointments may be canceled unless the member has active coverage. So it's very important to remember that the 90-day grace period is a safety net. It's not a strategy.
Very good. Great. So this is really helpful. We now kind of have the who, what, and the when. Are there any other tips that you can give us to ensure a successful renewal?
Yeah, absolutely. So, first of all, be sure that whatever you do, update your contact information with the FSSA right away. Be sure to open all mail from them immediately, as more than likely it's going to be time sensitive. Respond to their notices before the deadline. Keep copies of all FSSA correspondence, including copies of supporting documents that you provide to FSSA. And then do not wait until the deadline to seek IHFA renewal assistance. If you have any questions, any challenges with that, we have a great team that is ready and willing to help out when they can.
Well, I think this is great information that we can share with uh, Medicaid members directly, and I'm super happy this is being recorded because we can put it up on our website as a great tool.
Mhm.
But I also know that a lot of our audience members work with Medicaid beneficiaries directly on the front line. Uh, as the IHFA director too, I know that our program relies so heavily on community partnerships. Uh, that helps to build our success. Can you tell everyone a little bit more about what collaboration looks like between IHFA and our community partners?
Absolutely, and that's a great question, Anne, because collaboration is key, right? Whether we're working within our own program or whether we're working with other programs through the state, it works because our community partners are often the first to hear when a family is struggling with renewing their coverage. IHFA navigators bring technical expertise, and our partners bring trust and connection to families. And so when those two come together, renewals are completed on time, coverage gaps are prevented, and families stay connected to care.
That's great. And Bryce, again, I thank you so much. This was really great information. I want to make sure that I'm sure there is going to be some other questions from our audience. So I want to make sure we leave time for that. I do want to let everybody know before we take connections, how to connect with us and how to connect the people you may be assisting with us or maybe you yourself. We've made it super easy. You can simply scan that QR code and that will take you to a online scheduler to make an appointment with our first available IHFA navigator, or you can select a navigator you've perhaps worked with in the past. You can also call us, and our phone number is there, and our email. And then if you'd like to just visit and learn more information about us, our website. And then you mentioned community partnerships. If that is something you're interested in, you're not currently partnering with us, we'd love a chance to talk to you. We support organizations with really easy referral pathways, which I mentioned in the slide before. Our services are free and we offer unbiased health insurance assistance. So what that means is, we're not paid by a commission like an agent or a broker. So our job is simply to lay out the options for coverage for you and your family. And then we also offer educational presentations like this Lunch and Learn. We do staff trainings, community classes. If your organization has an outreach event or resource table you'd like to participate in, we're happy to help with that. And then if your staff just needs a little bit more education on Medicaid coverage, we're happy to provide that. And then most of all, we customize our support based on your organizational needs. So we really do a good job listening to like, hey, I deal with this population. What's the best way to connect your clients with our services? So I am going to open it up for questions. I'm going to stop sharing my screen so I can see. And Allie, I'm not sure if we have it in the chat. And if you can help me look for raised hands, maybe.
Yeah, so again, at this time, open for questions and answers. If you want to submit your questions, you can hover your mouse at the bottom of the screen. They may pop down from the top, depending on which view mode you're in, but you will see chat. You also see Q&A. You can use either of those to type in any questions you have, or as Anne said, you can use the raise hand function. You click that, we will see that you have raised your hand. We can unmute your line. You can ask your question verbally. So we'll go ahead and give it just a minute or two here to see if we get any questions.
And we love questions. So please don't be afraid to ask a question. Wow, Bryce, we must have done a really good job. Yep, I see Ashley's
Okay,
hand.
Ashley, feel free to go ahead. You should be unmuted.
Yes, I was wondering if you could give me a little bit more detail about this isn't maybe a necessarily renewal question, but when patients can qualify from going from emergency Medicaid to like a traditional, like a Hoosier Health Wise after, like if you could tell me a little bit more about
Yes.
the
Yep. So that's a
requirements around that. We work with a lot of immigrant
yeah.
population.
So that's a great question. There are qualifying immigration statuses that have to be met with the FSSA. And Ashley, I can, if you want to drop your email in the chat, I can send you a list of those qualifying immigration statuses. I think the big one that we see is the 5 year mark that they hit as a lawful permanent resident. So individuals that have their lawful permanent residency or their green card, um, that issue date on that green card has to be 5 years or more for them to qualify for full coverage.
Thank you, Anne. We have a couple questions that have come in. What about clients that have never received a renewal notice, like around the first birthday?
I would, in that situation, then suggest that you create an online FSSA login account so you can make sure a couple things. Make sure your address is up to date and those notices are going to the right place because that's a big one we've seen. I think Bryce mentioned that.
Yeah.
So you can either call FSSA and make sure your contact information is up to speed, or you can create that FSSA login account. Um, like Bryce mentioned before too, there were a lot of auto renewals or what we call ex parte renewals happening. So it wasn't uncommon for people not to get that, but you should expect to get that now. So I would reach out, I would encourage those clients to reach out directly to FSSA, find out when their redetermination is coming, and make sure that contact information is up to speed.
Another question, for the quarterly checks, are those only internal checks? Will the client only receive a pending letter if there's a discrepancy?
To the best of my knowledge, yes, those are FSSA conducted quarterly checks that rely on internal systems like employer history, or wage statement checks, things like that. So we have been encouraging our clients specifically, and as always, watch your mail so closely because those notices are deadline sensitive, and it is not going to be uncommon for HIP members to receive what we call pending verification notices. And they'll outline in those notices what documents need to be provided to support the information and verify the information that FSSA is pulled.
Thank you. Any more questions? Again, you can type that in the chat, the Q&A, or you can use the raise hand function. And another one has come in. How do we help a client make an FSSA account if they don't have a social security number? The children do, but it won't let us make an account because the child is under 18.
Yeah, unfortunately, without a social security number, you cannot create that FSA account. We've taken this to FSSA and let them know, like, hey, this can be an issue for our families that don't have social security numbers at this point. Now, I don't have another option to offer you, so you will have to call FSSA directly and call in the morning because we all know those wait times get really, really, really long in the afternoon. We don't have a back door either, so we sit on hold with you guys too.
Okay, well, thank you everybody so much for your time today. Again, we did record today's session and it will be on our YouTube channel in the next week or so. So thank you all.
Thank you, everybody. Thank you, Allie.
Thank you.